I'm Dr. David Hussey, and I'm an associate professor at Case Western Reserve University in Cleveland, Ohio. And I'm both a therapist and a researcher. As children develop, their brains grow and mature in remarkable ways. Adolescence is a particularly developmentally sensitive period. During adolescence, neural circuits adapt to environmental stresses through a process called plasticity, based on repeated physical and social experiences that lead to structural and functional brain changes. These changes can be both motory and sensor. They encompass emotional, social, and cognitive changes. Adolescents are drawn to vibrant experiences, including music, and compelled by enhanced self-awareness and enhanced desire for meaningful peer relationships. Music is both highly sensory and can be a central part of everyday adolescence experiences that shape and impact brain development. Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship. It is used in child and adolescent behavioral health treatment. Approximately 1 in 5 children or teens have mental health challenges that can benefit from treatment. More common disorders include behavioral, mood, and anxiety disorders, and attention deficit hyperactivity disorder. These are a variety of treatment techniques to address therapeutic goals, including music listening, lyric analysis, musical recreation, improvisation, and songwriting. We did clinical work with children and music therapy research. Our contributions related to the development, implementation, and evaluation of pioneering music therapy techniques for children with severe emotional and behavioral disturbances. Typically, those children resided in intense treatment environments. Those environments would be things like psychiatric hospitals, and in our case, primarily residential treatment centers too that had multiple components and multiple types of treatments that were available. We developed some innovative types of assessments, including individual and group therapy assessments. These assessments were then used to evaluate our clients and to measure changes in progress over time. The assessments we developed encompassed multiple areas of functioning. Here you could see the behavioral, social, trying out different activities, impulse control. Could also see that we had emotional targets, affect, coping skills, handling mistakes, and displaying affection. Language and communication were frequent targets, self-expression, expressive language, answering questions, responding to things like praise. And then musical awareness, musical skills, response to music, because we were going to use music therapy interventions. These were other key areas that we wanted to be able to assess. Using our innovative group music therapy assessment instrument, we found that specialized group music therapies designed to treat children and adolescents who had experienced complex trauma demonstrated improvements across the domains that I just showed you. Those domains reflect key executive brain functioning skills that are associated with working memory, mental flexibility, and self-control. These higher executive functions of the brain are interrelated, and successful application requires them to operate in a systematic and a coordinated fashion. Repeatedly applying and coordinating these skills in the context of group music therapy sessions allowed youth more opportunities to practice and develop the types of skills that they so desperately needed. In other areas of our work, other pioneering areas, we looked at music therapy, complex trauma, and developed a protocol for improving attachment by improving social reciprocity. Children with histories of severe maltreatment in concert with numerous placement disruptions experience complex trauma and attachment disorders. We used specialized music therapy techniques to increase their attachment and their social reciprocity skills. Social reciprocity skill development incorporates the ability to function as a member of a group by mutually cooperative types of exchanges. Because of their ability to relate to others through reciprocating verbal and nonverbal social interactions, these children, because they have deficits in these areas, oftentimes try to maintain control of relationships and situations and respond in maladaptive types of ways. They could perceive talk therapies as difficult and threatening. Music therapy can provide a more inviting and effective therapeutic medium. I want to share with you another example of some of the work that we did. And here you could see this is a case vignette of a young girl who was admitted to a residential treatment center at the age of 9. Briefly, she had 9 previous out-of-home placements, including 2 failed adoptions, and a lengthy psychiatric hospitalization. She had a full-scale IQ of 62, a history of extreme physical abuse and neglect, and her first out-of-home placement was at the age of 2.5. Her treatment was complex, and music therapy, both individual and sibling music therapy, played a key role in the overall therapeutic experiences and the various types of treatments that she had. You could see how long and complex the treatments can be, but her music therapy was a vital part of her treatment. And it helped to prepare her to begin visits with her new potential adoptive mother while still in treatment. Incorporated bonding and holding time, attachment types of therapies that were continued through day treatment. And finally, Carol and her sibling were successfully placed together with their new adoptive mom. In this case, music therapy was particularly appropriate and successful. Carol had an IQ of 62 and other developmental deficits, in addition to the comorbidities related to complex trauma and numerous placement disruptions. On a different note, research has shown that music listening can impact acute mood states. Today, with technological advances, music is more accessible. What's different is not only that we can immediately access our favorite pieces, but we could also track the effects of music listening on our physiological functioning, on our emotional status, and our social interactions. This information can be collected in real time. It can be tracked over time and analyzed to explore innumerable connections and outcomes. The emergence of science and the study of big data allows individual level data to be aggregated over large numbers of individuals and different types of conditions and situations, so that underlying themes and findings can be discovered. Advanced computer algorithms utilizing artificial intelligence or AI can discover latent themes in relationships that could significantly expand our understanding of the role of music listening in overall mental health and well-being. Increasingly, we can also supplement music listening and music therapy with other structured or spontaneous types of therapeutic interventions, such as mindfulness training, progressive muscle relaxation, deep breathing exercises, guided imagery, and exposure therapies. Either human or AI assets can guide and individualize these augmented interventions and potentially deliver them in real time when they can be the most beneficial. Going forward, we definitely need more money for music therapy and services and music therapy research. We also need to have less access to barriers for services. From a research perspective, disentangling the effects of music therapy are challenging, particularly in multimodal treatment milieus. I do want to mention that there can be potential downsides associated with music for young people. The old adage, all things in moderation, certainly fits here. Youth must assess and monitor their relationship with music And like all relationships, especially media relationships, avoid excess. While music listening can improve acute mood states, it can also enhance awareness of one's feelings. And if those feelings are negative, it can contribute to or prolong negative mood states. The key is to understand that the impact that music has in your life and to use that understanding to your benefit, not your detriment. On both a personal and professional note, I'm very excited and optimistic about what we will learn from research regarding the benefits of music and mental health. We are on the doorstep of discovery, and the future holds boundless opportunities to harness the power of music in promoting happiness, health, and well-being. Thank you.